when we perform surgery, I make small cuts, two small cuts in front of the ankle joint. In one small cut, we use saline, and the saline goes into the ankle joint, and we use a camera to look inside the ankle joint. Hi, my name is Dr. Sunil Ramawat. I'm an orthopedic surgeon with special interest in foot and ankle surgery. My practice is in Sydney West. Today I'm going to talk about an orthopedic procedure called ankle arthroscopy and its utilization and how it is important in the foot and ankle surgery. An arthroscopy is a medical procedure where a camera and instruments are inserted into a joint. In foot and ankle surgery, typically the arthroscopy is performed for the ankle joint. Occasionally, the arthroscopy can be performed from the smaller joints in the foot and ankle as well. The indication of ankle arthroscopy is to perform surgery to address any pathologies those affect the joint, such as ligament damage to the joint or cartilage damage to the joint, occasionally for infection to the joint. Sometimes it assists any minor fractures those affect inside the ankle joint. I also use ankle arthroscopy to address the pathologies in the back side of the ankle, including a bone in the back called osteotrigonum, which affects typically dancers. I also use the arthroscopy to address the headland deformity, which is a bump in the back of the heel, and that affects the Achilles tendon insertion site. In ankle arthroscopy, typically the patient is affected by a pathology that is affecting the joint, and when we perform surgery, I make two small cuts in front of the ankle joint. In one small cut, we use saline, and the saline goes into the ankle joint, and we use a camera to look inside the ankle joint. From other small incision, the instruments are used in the ankle joint to clean out the ankle joint, to clean the cartilage if necessary. For ligament repair surgery, which previously was performed with a conventional 3 to 4 centimeters big incision, now I perform with only 2 to 3 millimeter incision, and it's a technique called arthroprostome, where I pass the anchors into the bone called fibula, or this particular part of the bone called lateral malleolus, and those anchors then delivered arthroscopically or with the keyhole surgery into the ligament remnant, and then the ligaments are repaired with small incision, which is only 2 to 3 mils with ankle arthroscopy. Similarly, for headland deformity, conventionally the incision was about 10 centimeters long with the conventional surgery. However, with technique which include arthroscope, I make 4 small incisions. All incisions are about a centimeter, less than a centimeter each, and all these 4 incisions are utilized to remove the bump in the back of the heel and repair the Achilles back to the heel bone called calcaneus, pass some suture anchors. So again, it's a technically demanding procedure. It requires a long learning curve, but once you achieve the technique, it's a good option to address the intra-articular or inside the ankle joint pathologies, including ligament repair and headland deformity. At 6 weeks' time, majority of patients, they have complete relief of pain, and they feel that the pain is much less than the conventional surgeries. And that's my experience with the minimally invasive surgery, including ankle arthroscopy.